Welcome, everyone. Today we practice English in a very important real-life situation. We are at a pharmacy.
Yes, this is a slow English conversation for beginners at A1 and A2 level. We will speak slowly and clearly so you can understand every word.
In this conversation, a man is feeling unwell. He goes to the pharmacy to ask for medicine. He does not have a doctor's prescription. He needs help from the pharmacist.
You will learn how to describe your symptoms in English. You will learn the names of common medicines. You will also learn how to ask important questions about dosage and instructions.
This is real-life medical English for everyday situations. Let us begin right now.
Good morning. Welcome to City Pharmacy. How can I help you today?
Good morning. I am not feeling very well. I was hoping you could help me find the right medicine.
Of course, I am happy to help. My name is Sarah. I am the pharmacist here. Can you tell me what symptoms you are having?
Yes, I have had a sore throat since yesterday morning. It is quite painful when I swallow. I also have a mild headache and I feel a little tired.
I see. Do you have a fever as well? Have you checked your temperature?
I checked it this morning. It was 37.8 degrees. I think that is a little high, but not very high.
Yes. 37.8 is a very mild fever. It is slightly above normal. Normal body temperature is around 37 degrees, so you have a mild fever combined with a sore throat and a headache. Do you have a cough as well, or any difficulty breathing?
No cough, and breathing is fine, just the sore throat headache and the tiredness.
Good. That is helpful to know. How long have you had these symptoms altogether?
Since yesterday morning, so about 1 day now, maybe a little more.
And have you taken any medicine already at home, even paracetamol or anything like that?
I took 1 paracetamol last night before sleeping. It helped a little. The headache got better, but the sore throat is still there this morning.
That makes sense. Paracetamol helps with pain and fever, but it does not directly treat a sore throat infection. Based on what you have told me, your symptoms sound like the beginning of a common cold or a mild throat infection. I do not think you need to see a doctor yet, but I would recommend a few things.
Please tell me. I am not very familiar with medicine, so please explain simply.
Of course, first I would recommend continuing with paracetamol for the headache and mild fever. The standard dose for an adult is 500 milligrams to 1 gram every 4 to 6 hours, but you should not take more than 4 grams in one day. That is the maximum safe amount.
Okay, so 2 tablets of 500 milligrams would be 1 gram, is that right?
Exactly right. You understood that perfectly. Now, for the sore throat, I would suggest a throat lozenge. These are small tablets that you dissolve slowly in your mouth. They contain a mild anesthetic which numbs the throat and reduces pain. They also often contain an antiseptic which helps fight infection.
Throat lozenge. I have seen those in shops, but I was not sure what they were for. How often can I take them?
Most throat lozenges can be used every 2 to 3 hours as needed, up to around 8 lozenges per day. You should not swallow them whole. Let them dissolve slowly on your tongue or between your cheek and gum.
Between my cheek and gum, like this, on the side of my mouth.
Yes, exactly like that. Dissolving slowly allows the medicine to work directly on the throat tissue. If you swallow it whole, it will not work as well.
That is something I would never have known. I would have definitely swallowed it whole.
Most people do the first time. Now I also recommend a medicated throat spray. You spray it directly onto the back of your throat 2 or 3 times. It works very quickly for pain relief. Some customers find it more convenient than the lozenges.
Is the spray the same medicine as the lozenge, or is it different?
They often contain similar active ingredients but in different forms. The spray acts slightly faster because it reaches the throat tissues directly. The lozenge lasts a little longer because it dissolves slowly over time. Some people use both for better coverage.
Can I use both at the same time?
You can use both, but I would suggest spacing them out. For example, use the lozenge during the day, and if you wake up in the night with throat pain, use the spray because it works faster, and you can go back to sleep more quickly.
That is a very practical suggestion. Thank you. Is there anything else I should take?
I would also recommend a vitamin C supplement. When your immune system is fighting an infection, vitamin C helps support your body's natural defenses. You can take 1 tablet per day with food. It will not cure the throat infection, but it helps your body recover more quickly.
Vitamin C, I actually have some at home. I forgot I had it.
Perfect. Use it now while your body needs it. And of course, please drink plenty of water. Staying well hydrated is one of the most important things you can do when you have a sore throat. Warm water with honey and lemon is also very soothing.
Honey and lemon. My grandmother always said that. I thought it was just an old remedy.
It is actually very effective. Honey has natural antibacterial properties and it coats the throat. Lemon provides vitamin C, and warm liquid generally soothes inflammation. Your grandmother knew what she was doing.
I will tell her you said that. She will be very pleased. Now, can I ask about the prescription? Do I need one for any of these medicines?
No, everything I have recommended today is available over the counter. That means you do not need a prescription from a doctor. You can buy them directly here at the pharmacy.
That is very convenient. What does over-the-counter mean exactly? I have heard that phrase before, but I was not completely sure.
Over-the-counter means medicines that are sold directly to customers without needing a doctor's prescription. These are medicines considered safe enough for people to use without direct medical supervision. Prescription medicines, on the other hand, are stronger or more complex medicines that a doctor must authorize before you can buy them.
I understand now. So paracetamol, throat lozenges, throat spray, and vitamin C are all over-the-counter medicines.
Exactly. All of those are available without a prescription. However, if your symptoms do not improve within 3 to 5 days, or if your fever rises above 38.5 degrees, I would strongly recommend you see a doctor. A high fever or symptoms that get worse can sometimes mean a bacterial infection, which would need antibiotics. And antibiotics are prescription medicines.
So if I get worse, I must see a doctor and they might give me antibiotics.
Yes. Antibiotics are only for bacterial infections. They do not work against viral infections like a common cold, so it is important to see a doctor first who can assess whether you need them or not.
I understand completely. I will monitor how I feel over the next few days. Can I ask one last question, please?
Of course, please go ahead.
Is it safe to take paracetamol and the throat lozenge at the same time, or do I need to wait between them?
They are completely safe to take together because they work in different ways and do not interact with each other. Paracetamol works inside your body to reduce fever and pain. The throat lozenge works locally on the throat surface, so you can take them at the same time without any problem.
That is very reassuring. Thank you so much, Sarah. You have been incredibly helpful and very clear. I feel much better about managing this now.
I am glad I could help. Remember, plenty of water. Rest as much as you can. Take the medicines as directed, and come back or see a doctor if things do not improve in a few days.
I will remember all of that. Thank you again. Goodbye.
Goodbye. I hope you feel better very soon. Now let us speak to our viewers directly.
Did you understand that conversation? We were at a pharmacy asking for medicine for a sore throat, fever, and headache.
We learned very important vocabulary for health and medicine in English.
Let us now review the key vocabulary from this conversation.
A symptom is a sign that something is wrong with your body. For example, a sore throat, a headache, or a fever are all symptoms.
A pharmacist is a trained professional who works at a pharmacy and gives advice about medicines.
A prescription is a written instruction from a doctor that allows you to buy certain medicines.
Over-the-counter means medicines you can buy directly at a pharmacy without a prescription.
A lozenge is a small medicated tablet that you dissolve slowly in your mouth.
Dosage means the correct amount of medicine you should take and how often you should take it.
An antibiotic is a medicine that kills bacteria. It does not work against viruses.
Now let us do a short speaking practice. How would you describe a sore throat to a pharmacist in English? Think of your answer now.
You could say I have a sore throat. It is painful when I swallow. I have had it since yesterday.
Or you could say, my throat hurts. I also have a mild fever and a headache. Can you recommend something, please?
Both are clear, polite, and very effective ways to describe your symptoms.
Remember, in medical situations in English, always describe your symptoms clearly. Say when they started, say how severe they are, and ask if you need a prescription or not.
Now, a message to all our viewers. Your health is important. Knowing how to communicate in English at a pharmacy or a doctor's office can make a real difference. Practice these phrases until they feel natural.
If this video helped you today, please give it a thumbs up. It really helps our channel grow.
Write in the comments, have you ever been to a pharmacy in English? What did you say? Tell us below.
Subscribe for a new slow English conversation every single week.
Thank you for watching. Goodbye, everyone. Stay healthy and keep learning.
Goodbye. See you in the next lesson.